Hey there, posture guys and gals, and welcome back to the show. As always, I'm your host, Justin Archer, aka the Posture Guy, your #1 source on pain, posture, and performance. And today, we're going to be going over how to properly differentiate between swayback and lordosis, because these are two very common postural deviations that I often see people get mixed up and confused with one another. And they are definitely different, and it's important that you are diagnosed properly, whether it's you're diagnosed by someone like me or you diagnose yourself. That way you know you're heading in the right direction for whatever treatment that you use. Because I'd have to say, in my experience, best case scenario is I get a call or an email from someone saying, help, I don't know which one I am, swayback or lordosis, or maybe a combination of the two. What do you think? They send me some pictures. That's best case scenario. Worst case scenario is someone calls or emails and says, they've been doing an exercise routine for a swayback posture and to help get rid of their pain, whether it's something they've been doing from the postureguy.com website or something that another health expert recommended they do. And they're asking for more help, and I have them send some pictures in, and they send the pictures in, and right away I go, uh-oh, there's the problem. They're not actually swayback, they have lordosis. So they've been doing an exercise routine for a diagnosis they've been given or they think they have, and that's why nothing's getting better. Or worst case, I guess the absolute worst case, is by doing an exercise routine that's for the wrong diagnosis, the wrong postural deviation, they've actually exacerbated whatever symptoms they might be experiencing. All right, and I know we all want to avoid that. So what I want to do today is show you how you can figure out which you are. Are you swayback? Do you have lordosis? Maybe you have a combination of the two. And then I've actually done posts about each of these postural deviations in the past, which I'll link to down below. And inside those are exercise routines you can follow to correct those postural deviations, whether it be swayback or lordosis or a combination of the two, and get you out of pain. All right? So let's get started. First of all, probably the easiest one to tell if you have is swayback. It's really easy. What you want to do is look at yourself in a mirror from the side, right, from head to toe, or maybe easier, have a friend or family member take a picture of you from the side and then look at the picture. Basically what you're looking for is where is the shoulder joint in relation to the hip joint, okay? If the shoulder is vertically stacked right over the hip, perfect, good posture, at least in the upper body. But if the shoulder presents itself posteriorly or sits behind the hip, then you have swayback, all right? And you want to check both sides, make sure it's not, back here on one and on the other side it's forward, because that wouldn't be swayback, that would be thoracic rotation or torso rotation. So make sure both shoulders are back. If both shoulders look like they're presented posteriorly or behind the hip, then you have swayback. Another tell is usually as a way to compensate for your upper body leaning back, so you don't fall back on your head every time you stand up or try to walk. What your body will do to kind of recalibrate and get some semblance of balance is it'll throw your shoulders and your head forward, and you'll get this kind of hunchback posture, otherwise known as kyphosis. Basically means an extreme curvature of your mid and upper back area. So it'll look something like this, all right? If that looks like you, then you're swayback, and in that case, check out the link down below that says correcting common posture deviations, swayback with thoracic flexion, and then in parentheses it says AKA hunchback or hunchback posture, all right? And inside there, watch the video and then do the exercise routine found inside that post, all right? So that's swayback in a nutshell. Lordosis is a little bit more confusing, but only just a little bit, all right? Again, it's easy to see from the side, and basically what we're looking at is the lower back, okay? And what's directly below the lower back is the pelvic girdle, right? So here you can see pretty neutral position, but as I roll my hips forwards, as I go into an anterior pelvic tilt, notice that the curvature of my lower back gets bigger and bigger and bigger. So lordosis is an excessive curve of your spine. Lumbar lordosis is speaking relative to the lumbar spine. You're supposed to have an inward curve too in the cervical, but for the sake of this video, we'll just keep it to talking about the lumbar spine, because that's usually the one that people most get confused with swayback, okay? So if you have an anterior pelvic tilt, which you can look at as your waistline here, if you're wearing a belt or elastic band here, if it's tipped forward like that, and there's an excessive curve in your lower back, then you have lordosis, okay? Now, this could be for one of two reasons. I'm going to kind of be generalizing here, but someone may have that anterior pelvic tilt either because their muscles are short and tight or long and taut. And about 2 weeks ago, I did a post on this, which I'll link to down below, and it was in the context of more towards athletes, but anybody can benefit from watching this video. The title is, again, it's linked to down below, Short and Tight versus Long and Taut Athletic Postural Types. And what it talks about is, okay, yeah, usually most athletes have an anterior pelvic tilt, but it may be that way because their muscles are short and tight, which in that case, there's going to be more stretching involved, still some strengthening, but probably more stretching. And a sign of that is you'll have the anterior pelvic tilt, and you'll have the lordotic or inward curvature, excessive inward curvature of your lumbar spine, but the knees and feet will most likely point in an outward direction, okay? That's number one. The second type, or second category, is an athlete who is, or it doesn't have to be an athlete, it could be anybody, who has the anterior pelvic tilt, but it's like that because their muscles are long and taut, in which case you'll see if you look straight ahead at yourself or a picture of yourself, the knees will point inward. And that's more of the long and taut condition 1 anterior pelvic tilt posture type, all right? So in the link down below to the short and tight versus long and taut athletic postural types, there's an exercise routine for both the short and tight and the long and taut. So look inside that link, watch the video, and then do whichever exercise routine most closely resembles to whatever postural type you are, the short and tight or the long and taut, all right? And that is basically lumbar lordosis in a nutshell. Now you might be asking, okay, Justin, that's great, sounds good and everything, but what if I have both, right? What if I have lordosis and I have swayback? Which do I do first? How do I go about this? Well, I would say address the lordosis first, because that will relieve a lot of pressure on your lower back and help bring your hips back underneath of you. And as a result of that, your body, as amazingly capable as it is, as smart as it is, will actually start to recalibrate your spinal curvature. So a lot of times, if your hips are bailed out in front of you, the spine up above, your mid, your upper back, your neck, head position, all that is basically compensating. It's adjusting to and reacting to everything below it. You get this back underneath of you, you go from a lordotic or an excessive curvature in your lower back to a more neutral position, and things like this, where your upper back's like this, your sway back, all that will start to kind of correct itself. So if you have both lordosis and sway back, then I would use the exercise routine and go after the lordosis first, and then once that looks better, and you can just look in the mirror, look at pictures of yourself, then I would suggest going after the sway back, okay? So hopefully that helps you, like I said, better recognize which you have, swayback or lordosis or both, and then how to properly go about treating it, all right? But if any of this is confusing or if you have any questions about it, please don't hesitate to ask down in the comment section below, because that's where a lot of the learning occurs, both for you, me, and all the other posture guys and gals out there, all right? Thanks for watching today, and I look forward to seeing you inside the next video. Until then, take care and keep moving.